So we've treated gravity by doing a neck lift, a deep plane facelift, the upper blepharoplasty. But the second category of aging that we want to treat is the volume loss. We don't want to put so much fat or filler in a face that it makes it a round ball. We want to use fat as a little sprinkle, a little spackling material to soften shadows so things look harmonious and balanced. When we lift gravity, we got to lift the volume loss too so that they look really pretty and no one can tell anything was done. So for this patient, she's very skinny, very athletic overall, but we always find the fat. And we like taking it from the inner thighs on people who are skinny or have had a tummy tuck in the past. Otherwise, sometimes we take it from the abdomen. We take that fat, and currently we've harvested it, we've taken it out, we've put it into a centrifuge that's spinning it, and that's gonna clean up the fat a little bit. We also have some other methods we have of cleaning the fat, so we're left with little seedlets of fat. So we draw it up into individual syringes, and we use cannulas, which are atraumatic. There's no point to that tip, so it doesn't hurt blood vessels. That kind of slinks by them, and has a tiny little hole there that is about 2.4 millimeters. It's just big enough to get out what's called microfat. And microfat is, again, a nice seedlet size that it can add some volume and can add some strength as a spackling material to fill in shadows like we've marked here preoperatively, this little triangle called the marionette line, that now we're going to take and inject strategically in certain parts of the face. We don't inject it like injecting a filler. It's not a big ball of jello that goes right into the skin. It's little droplets. We inject it like we're sowing seeds in a garden. So a little droplet here or there into the soil so it gets its own blood supply. It's nice and healthy, and then it becomes part of your face. Sometimes 50% of what we put in takes, sometimes 100% of what we put in takes. We do not make the mistake of over-injecting the fat, because if 100% stays, if we've over-injected you, it'll look funny and deformed. So we never do that. We always inject to what looks right during the day of surgery. And if 100% stays, great. If 50% stays, it's still just spackling material. It's made things softer and better. That's how we keep our patients safe. And it's very rare that we have to go back and do another fat transfer, because most patients are just thrilled with how natural and harmonious everything looks.